Towers in Countryside, Anderson Square in Georgetown, and Centennial Towers in West Bay. And by the Ministry of District Administration. Explore your history, explore your land, explore your sister islands. And Cayman Airways. Call them on 949-2311 to book your nonstop flights to Los Angeles and Panama. And Doctors Hospital. Peace of mind is important when life happens. Doctors Hospital. Always there for you. Call 949-6066.
But I do have some questions.
There are more questions than answers.
Cayman Islands' foremost listeners' participation program.
Talk today.
What is on your mind, Cayman? If you are ready to talk, we are ready to listen. Here's your host, Sterling Dwayne Ebanks.
Hey, welcome, and thanks very much for joining us. It's an honor to be able to always welcome a good friend, Mr. Shomari Scott. And no matter when you see him, you always can imagine him in a basketball uniform, a ball in his hand. He's poised to make a three-pointer, and then he looks across to his good friend Miller, and he says, "This is how it's done. Let me pass it off." You'll be a part of our conversation, because whether it's maternity or neonatal or postpartum, we're gonna get a chance to share with you with our friends from LCD. So stay tuned for Talk Today.
Avoid any statements or comments which are abusive, derogatory, malicious, or defamatory. Do not use indecent language or make any statement that is false or misleading. Call 1-800-534-8255, 949-6990, 949-8037, or WhatsApp us on 925-3261.
Email Talk Today at candw.ky. Let your voice be heard. And now, back to Sterling Dwayne Ebanks, Radio Cayman Talk Today.
It's often said, that the hand that rocks the cradle rules the world. I've always thought that he who tills the soil feeds the nation, but there's nothing more important than the love that a child can feel from the mother's womb, and the hands that take care of that mother ensures that the future is always not just nurtured and protected and provided for, but cemented. Shamari, we're the products of good mothers.
Oh, most definitely.
Thankfully, good sisters as well.
That's one thing we can. That's one thing we can agree on. You know, you and I may not agree on a lot, but that's one thing.
No, we disagree on sports. What's the best food?
Mm-hmm.
Yeah, there's not much to
agree
on.
About how long it took you to comb your hair, why you had us waiting.
Guy, do you know how much work this takes? Perfection takes a long time. I'll never get there.
But no, it's a pleasure to be here as always. Dwayne Sterling,
Dwayne Ebanks. Come on, now, don't be like my Sterling. Come on, you can do it.
Oh, this is what your mama name is. Sterling Dwayne.
Yeah.
I always call you Dwayne Sterling.
Yeah, it sounds like Raheem Sterling, but I'm not a good football player.
Yes. that we know, and definitely not a good basketball player.
We know,
but definitely a pleasure to be here. And as you know, we usually show up once a month, just because you are so special. We leave it that we can't go without a month.
Month of visitor.
Well, for you, sometimes, for the most part, you weren't here. You hear that Hell City is coming in because I'm there. You didn't show up, but that's okay. We always, take the baton and move forward. But we have a special guest with us today, and we're excited because over the years, Sterling Dwayne, Ebanks, we've been talking about all of the new areas that we're filling gaps within the Cayman Islands and the greater Caribbean. And one of the areas that is new to our new hospital that we have, Hell City at Camana Bay, is our maternity services. We will speak to our NICU services as well, which is all a part of the great unit that we have there eventually. But today we have Dr. Mamatha Gowda, who is here with us. She has over 2 decades of experience, and she's a consultant for obstetrics and gynecology. And at times, she wouldn't want me to tell you all of her secrets, but she is so fabulous that they always, and you always have these sayings, right? And if you can't teach it, that means do you really know it? Mm-hmm. And she's trained several of her colleagues in obstetrics and gynecology, And outside of that, now this one I'm going to read to make sure I don't get it wrong, right? There's several prenatal therapeutic procedures that are very unique that Dr. Gowda would have done. And the one that is even the most unique is the intrauterine embolization of fetal vein of Galen malformation. And it's the third case of prenatal therapy in the world such as that, and the first to be performed using a technique of glue injection. Is that correct?
Yes.
See? All right. So I
We want to read it again, though.
I got through all of that, and I had to read that one for you. I just didn't want to mess it up. But it just shows you the level, and Dr. Gowda wouldn't want me to say this, but the level of expertise that we're bringing that's world-renowned here with us at House City, across our services, but even more so now, especially when we're dealing with the most precious lives that we have. That we're so happy to have Dr. Gowda with us, and we'll be going through, the maternity services that we have at Health City at Camana Bay, and we'll also speak to the various areas that Dr. Gowda will be able to cover to give expectant mothers the type of confidence that they would need to come to Health City, knowing that we're filling the gap, and then on the back end as well, if anyone needs the NICU services instead of having to travel overseas, which we know these types of and usually I'll talk about ailments, but these types of situations, right, was always going to be stressful. And if you have to go overseas, it's even more stressful at a time when you should be having as least amount of stress as possible. We're here, and this was one of the areas that actually traveling throughout the Caribbean, throughout Central South America, that they said, you have great cardiac services, you have great neuro services, great orthopedic services. If there are two things that you could do in the future, and this would have been 5 years ago, they were saying when it comes to radiotherapy from an oncology perspective, we as the Caribbean always have to send our loved ones overseas, and outside of the cost in and of itself, a lot of people wouldn't be able to gain access because it's the most costly of the medical services at times. Staying away from family for 4 weeks, 6 weeks at a time isn't best for anyone. So that was one of the areas. And then the other area was to do with maternity and neonatal services and NICU. And they call them $1 million babies, right, in the rest of the Caribbean, as well as here. Because if you have to go overseas, that's the starting point. And a lot of insurance coverage in these areas, that might be your lifetime max or may not even reach your lifetime max, and therefore you can't gain access. But outside of that, Health City has become trusted throughout the Caribbean, obviously here locally, and even in insurance providers as well as parents that can gain access to the U.S. now are choosing us based on the quality and excellence that we bring to the medical field in the Caribbean.
No, thank you for taking that time. Because as I looked at the media sheet earlier, I recognized that there are times when you want to expound on something and you will access available research, and it's an honor, Mom, to welcome you. When we come back from our first break, I want you to share with us, because what it does is it not only instills confidence in the competence of what the community has readily available, but it cements in us this thing that could serve as a future career for some of our aspiring students, but a sobering reminder that in our communities we have this thing that we don't have to, be worried about just in case. Maybe not. But that's on the sort of specialize in, but even the, neonatal, from the impact of postpartum on some of us, just having that discussion. So maybe you could take us through, give us a perspective when we come back from the break, and give us a reassurance.
Yeah, sure. And I thank you both guys for having me here, and all the comedians for letting me stay on your island. Yeah, we'll talk about it after.
You're most welcome, and feel that warm talk today. Radio came on, hospitable, love and welcome. Yeah. Hey, we're going to get there because it's what strengthens the community.
That's right.
Excited to learn more and share as we invite you to join us right after the break.
Did you know ordering your favorite sandwich from Subway just got easier? Yeah, picture this. No more waiting in line. No more fussing with cash. Just the delicious taste of Subway at your fingertips. With our new app, ordering your go-to sub is as easy as a few taps on your phone. Plus, receive exclusive deals and earn loyalty points with every purchase made on the app. Download the new Subway app today and get ready to ditch the lines and drive straight into your flavor. Visit the App Store or Google Play Store on your mobile phone and search for Subway Cayman Islands. Subway. Eat fresh.
Stay cyber secure with Cayman National. Here are a few tips that will benefit you. Ensure to log out completely when you finish any online banking activities. Be aware of phishing attempts and only click links from trusted sources that are sent from your device through emails and messages. Remember, Cayman National will never ask you for your credentials. If you suspect a fraud attempt or that your account has been compromised, please immediately contact our customer support team at 949-8300.
Did you know that Doctors Hospital provides urgent care services 24 hours a day, 7 days a week? And Doctors Hospital's urgent care physicians have access to the most advanced MRI and CT imaging in the Caribbean, providing reliable diagnostics when you need it most. When you need quality urgent care for an illness or injury, Doctors Hospital is here for you 24/7. Whether it's a migraine, chest or abdominal pain, shortness of breath, broken bones, or another urgent need, Doctors Hospital at the top of Walker's Road. Urgent care right now.
Cayman, could it be you? Tortuga's 10K giveaway is back, and someone's walking away with $10,000 in cash. Every time you spend $25 at Tortuga, in-store or online at tortuga.ky, you get a shot at winning big. As well as $10,000 in cash, we've got thousands in giveaways to hand out every week. Think staycations, the latest iPhones, exclusive experiences, and more. Get in to win. Visit tortuga.ky for the full terms and conditions.
Wouldn't it have been grand if you had purchased land 30 years ago? It may not be 2020, but a perfect vision has never been more clear. Cayman Brac and Little Cayman, poised for growth with an eye on the future. Your land, your history, your future. Discover all that our sister islands have to offer.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Hey, welcome back in from Health City, Mr. Shamari Scott, and hopefully I say it with the love and respect and equally with as much of the excellent pronunciation as Dr. Gowda. Did I have it correct?
Yeah.
Truly, again, welcome. And one of the things that I admire and truly respect about educators who stand in front of a classroom to teach our young minds, or physicians like yourself who bring not just a competence, but a sense of empathy and compassion, and maybe your interns as well as some of us as the family of your patients, a level of knowledge, instilling confidence, but share with us what is happening as your patient, our family member is going to be going through this, phase of life, whether it's giving birth, whether it's expected to be easy peasy and was it macaroni and cheesy, or it's going to be something here. Unfortunately, this is risky and this is complicated, but you get the assurance. Thank you all for doing that in a way that helps us. Right.
Thank you.
Well, welcome. With maternity and all the things that go up, we hear, for those of us who've been blessed with the good fortune of going through and having our children, a lot we experience, and we hear words like neonatal and prenatal and postpartum, and we hear all these other things, and they're all the checks, and sometimes we just not quite sure what's happening, but we're just glad that all the right number of fingers and toes on the right places and everything seems okay. But it's not a simple process, so to speak. but it's not as complicated. I don't know. You tell me.
Yeah. You left out the pre-conceptional phase. The most important is planning.
Preconception. I was thinking.
Exactly. It's just prenatal is once you get pregnant, but your work should start before you get pregnant. So because a lot of medical conditions may be there, whether this is the right time to become pregnant, is it going to get you a right outcome if you get pregnant now? Those kind of planning should start even before conception, because a lot of things can lead to a complicated pregnancy if you're not planning it well. So that phase is the most important phase, if you ask me.
All right.
So what begins well ends well.
All right.
So
I appreciate that. If I could ask you that, because there's a joke among some of us as fathers now, when we would say, oh, when we were pregnant, and our wives and their friends would go, we? We? I don't know, we here.
That's a common terminology. Men also are pregnant when women are pregnant. Why should women only be called as pregnant?
Yeah.
They just carry the baby, but the burden should be carried by both.
Right. That's right. And that sort of preconception that you shared, some friends had said, listen, as much and as important as it is for the expectant mother to long beforehand start to take care of her body and do certain things, and then during, that gestation period, but it's also important for the father, physical health and all the other things, so that the output.
Exactly. For example, if they're smoking before conception,
right,
that can affect the fertility. If they, of course, if they're not, the exercise increases competency also, I should say.
Yeah, see the words how we are so polite. My mother's listening. Thank you. She's like, no, behave. But those are the things that very much similar to a basketball game. You're going to practice and prepare so that when you go to the game, you're as well equipped as you can. We need to do this likewise, right?
Yeah, definitely. Of course, the work is more for the women, but yeah.
You know what? I'm going to behave. I don't know you that well. I'm going to leave that alone. But so that preconception, are there things, eat and drink, healthy foods, avoid certain things, exercise, de-stress as much as possible. Is that 6 weeks before, 6 years before?
As much as possible, like at least 3 months before. That is what we would usually advise. And certain medications that women may be taking, or very rarely men may be taking, may have to be changed preconceptionally, because if the condition is not controlled well before pregnancy, as I said, it could lead to some problems in pregnancy, as well as the kind of medication that they are taking before pregnancy may have to be altered during pregnancy, because the same things may prove toxic to the fetus once they conceive. So that kind of preparation should begin ideally 3 months before they plan for pregnancy.
Okay.
So that's what I would recommend.
Put your body through a regimen that, I'll use the words that I think you correctly, detoxes. Try to improve your health, your mental, your physical. Do this consciously.
Yes.
All right. Some of us may do, and that may work. Some of us, it may be delightful, unexpected occurrence, unplanned, but we're happy for it. So in that event now, that whether we plan for it, we've done all the good things to prepare as much of a successful merger.
Yeah.
We now have that. That conception.
Yeah.
What we are at that stage now. What then?
Yeah. So prenatal care, it as I said, should begin very early in pregnancy. So there are a lot of things that can develop during pregnancy that may be of concern to the women, but these are usually physiological and they usually go away spontaneously on their own. But these symptoms may be overlapping with problematic symptoms also. For example, if the women may experience something like excessive vomiting or what we call as morning sickness, it's kind of uneasiness and they may not be taking the food intake, may not be good. They feel nauseated all the time. So this is kind of physiological up to a point that the woman can tolerate. But this can also be a serious problem. For example, we call it as vomiting in pregnancy that can get exaggerated to something called as hyperemesis in pregnancy, where the excessive vomiting can make the mother sick. So a lot of electrolyte disturbances, and it can lead to serious problems. So similarly, bleeding during pregnancy. So sometimes a little bit of spotting is considered to be normal when the embryo is getting implanted in the uterus. However, more significant, if it is more, it could also mean there is an abortion that is threatening to happen. So it's very important that women are educated as to what is normal and what is abnormal, and when should they seek the care, hospital care. Because most of the things can be managed on their own. But if the symptoms get severe and if they do not take the care on the right time, do not approach the hospital in the right time, it can lead to complications. So that, and then educating themselves. Yeah. So there are a lot of literature available online, and this is an internet age and anybody can search anything they want. But it is also important that you get this information confirmed or verified by a professional. So usually most of the hospitals will have these educational programs as soon as they conceive. Like we start with confirmation of the pregnancy and tell them about what to expect during pregnancy and when to contact, what are the red flag signs, when they should approach the hospital, things like that. And also advise them about what kind of diets they should take, what changes have to be made to their lifestyle. And usually there is a misconception that once you are pregnant, you should just lie down on the bed and just take rest. So that's not the correct way to do it. And women should also inculcate the habit of doing some exercise that is good for their throughout pregnancy as well as in the later in life. Yeah.
And Dr. Garu, with that, when you use the word, an abortion is likely.
Yeah.
I heard the word miscarriage. Is that the same thing that we would use colloquially, so to speak?
Yeah, usually, abortion is kind of a raw word. Yeah. Miscarriage can mean, abortion usually means anything like it can happen on their own. Usually it's a term used when the viability is not reached. Yeah. That is, if the baby is delivered, it is not able to survive on its own. Yeah. So it's used interchangeably. It's nothing like this is different from that. Yeah.
No, thank you for that. And the reason why I wrote that word down is that it's apparent that only after a woman has experienced that you realize how frequent it seems to be an occurrence, and how at the same time very few families would talk about it even amongst themselves, and how that seemingly impacts the woman, the mother in particular. Sure, it affects the father as well, but for some reason we don't address it and then impact whether that's the first child or whether that is one and there are previous ones. So that impact psychological, physiological as well.
Yeah, it's pretty common actually. If you want to quote the international figures globally, they say 15 out of 100 pregnancies end up in a miscarriage.
15% ratio.
So most of them may not be recognizable because some of these are chemical pregnancies, which you can recognize only if you do a chemical test. So women may not have missed their periods, so they will never realize that they have aborted. So clinical pregnancy abortion is also pretty common. But for women, pregnancy is something like it's an enjoyable thing and which they want to do it. And having a miscarriage, as you said, can lead to a lot of psychological problems. It is also something that women gauge themselves as per their competency. If there is a miscarriage, they may think that they may not be fit to be pregnant, and why did it happen to me and not to others, and the guilt that they carry with that can have a long-standing impact. But they should understand that this is something that happens to many women, and it's usually sporadic. It just one-time occurrence. It doesn't usually recur in next pregnancies unless it's a genetic disorder. So that kind of guilt they should overcome and take upon the next pregnancy with a lot of hope.
All right. Well, we've got a scheduled break. When we come back, tell us more about, the services. Take us through as much as you want. The more we know, the better we are in decision making. To Dr. Gowda and Mr. Shamari, join us after the break.
Subway and Oreo has changed the dessert game. Introducing the Oreo footlong cookie, a full 12 inches of chocolatey, creamy goodness. It's big, it's bold, and it's here for a limited time. Perfect for sharing or not. We won't judge. Want it fast? Order ahead with the Subway Cayman Islands app for quick pickup and earn loyalty points, or get it delivered straight to your door with Bento and Let's Eat. Don't wait. Treat yourself today. The Oreo footlong cookie is calling your name. Subway. Eat fresh. Snack sweet.
Accidents and illnesses can strike without warning. Ouch! When it comes to urgent care, every second counts. At Doctors Hospital, we have a dedicated team of experienced doctors and nursing staff available to you 24 hours a day, 7 days a week. Don't waste time in an overcrowded emergency room when you need urgent care. Whether it's a broken bone, a severe infection, or a sudden illness, trust in Doctors Hospital's unwavering dedication to providing the best immediate care. For complete urgent care when you need it the most, choose Doctors Hospital, located in Georgetown, 16 Middle Road.
Easter vacation is just around the corner, and Cayman Airways has added multiple extra flights to some of your favorite destinations, some of mine too. Look here, they got seats available now for booking on extra Easter flights between Grand Cayman and Kingston, La Ceiba, Miami, Cayman Brac, Little Cayman, and you can even catch a non-stop flight to Montego Bay for Easter. Check it out. You can visit CaymanAirways.com, contact a local travel agent, or call Cayman Airways Reservations on 949-2311. And don't wait too long though, because these extra Easter seats always sell fast. Be sure to add your Sir Turtle Rewards number to your booking so you can earn more miles for more free trips this year. Well, I know where I'm going. I'll see you on board a uniquely Caymanian airline for Easter.
The offices of dermatologist Dr. Wayne Porter will be taking appointments February 22nd to the 28th at his Crew Road Clinic. Appointment slots are limited whether you're seeking advanced skin care, Botox, filler, cosmetic skin enhancements, or simply looking to reduce wrinkles. Dr. Wayne Porter offers a full-service dermatology and dermatological surgery practice. For more information, email Dr. Porter Cayman at gmail.com. That's drportercayman@gmail.com. Call 946-9020 to book your appointment today. That's 946-9020. Radio Cayman's Talk Today. What is on your mind, Cayman?
Hey, welcome back, and honored to be able to welcome to the studio to celebrate perhaps what in my mind may be another remarkable milestone for Health City Cayman Islands, for the wider Cayman Islands, but for the Caribbean region. As we talk about maternity services at Health City, Dr. Gowda with Mr. Shamari Scott. For me, Shamari, this is something that helps us to appreciate the strength of our community. And Dr. Gowda, as you take us through and share with us, we love the idea of, an expectant mother having a safe pregnancy, to watching that child come out and grow into a community and herself become a physician or an educator or the like. But that takes, as you said, thinking about it before conception, doing the right things after, and then going through. Now, are there particular stages and periods immediately, say following conception and the ensuing period of following birth, that are so significant that we make sure the environment, the nutrition, all the other supporting stuff, the viability of mother and child as a healthy, living, just loving being? Are there particular things that we should pay attention to?
Well, women have been giving birth since God knows how many years. So that said, people do already know what are the right things to be done during pregnancy. However, the things are changing. Like things keep evolving, and it's quite a dynamic world that we are living in. And apart from the fact that you give attention to your nutrition. There are a lot of things that we can talk about nutrition, but that also depends upon the culture and the region we are living in. So the food that we recommend to one region may not be palatable or acceptable to women in some other region. So what we recommend is you eat what you like, but ensure that you take the right amount of protein, right amount of carbohydrate, and the right amount of fat. So this is what we call as balanced diet. So in the initial period of pregnancy, maybe the 3 months, as I said, because of the nausea, they may not be able to eat much. But the demand during the initial period is also not much. So baby is quite small and the mother is not putting on much of weight. So during the initial 3 months of pregnancy, yes, eat, but frequently and small meals. So small, bland and frequent meals is something that we recommend for eating. So that will also decrease the vomiting and the nausea that women may experience, as well as make the nutrition go into the women. Like they need not vomit it out. If they eat in bulk, they may vomit out everything. So that's one thing. And the exercise I already talked to you about. And exercise also, it's not something that we wouldn't recommend you to start something new. Like if you are not a swimmer, we wouldn't say go learn swimming because you are a pregnant woman. So if you were a runner before, if you were a walker before, I mean, whatever exercises you were doing, you continue doing that. But the intensity should come down. So if you were doing heavy exercises, make it moderate now that you are pregnant. And maybe sometimes if you're a complicated pregnancy or something, maybe we would recommend mild exercises, or sometimes very rarely bed rest may be advised. So that's one thing. And if you were smoking, you were a smoker before, we would recommend that you stop smoking, because smoking can lead to a lot of other problems. For example, the placenta may not grow well, and the placenta is the vital organ, I mean, for the baby. That is the one from where baby gets its nutrition, the blood supply. And if there is smoking, the placenta doesn't grow well, and there will be a lot of calcifications and kind of it doesn't develop well. So also the placenta may get detached, what we call as abruption. So some of the problems can be avoided if these habits are stopped. And alcohol during pregnancy, it's very common for women to consume alcohol, but it may be very difficult to stop it during pregnancy. Just because I became pregnant, I don't want to stop alcohol. But what is recommended is there is no amount of alcohol which is safe during pregnancy. But if you are not able to stop it, make it as minimum as possible. Be restricted to 1 or 2 glasses per week and not more than that. So that kind of restraint should come from the women. And if she's not able to do it, better others who are surrounding her keep a watch on her and maybe try to tell the advantages of it rather than outright dissuading from alcohol use. So these are some of the adaptations that women can do to already what they are doing. So it usually requires very minor changes if it is a low-risk pregnancy, and only if it is complicated, if there are any medical conditions which require special care, then it's going to be more intense changes that we recommend.
Okay. Now, what about that first time a mother, whether she's very young or maybe she's, a little more mature?
Yeah, primigravida, that's what we use as. Young mothers, added to that is the psychological problems. They do not know what they are going into, what are they jumping into. So it's like a race. So everybody is having a child, so I want to have a child. So young mothers are likely to be do not have much idea of what changes may happen in their body. First of all, if the changes that they happen, like the psychological mood changes, as well as the muscle also, like you feel very tired during pregnancy, these can cause a lot of stress to the woman. They think, okay, all the changes that are happening, are they going to be permanent? Are they going to disfigure me? Are they going to make me less attractive or something like that? Those are some of the concerns they may have. as well as handling the pregnancy. Or experienced women, like if they had a previous pregnancy and they had had a normal delivery or a good experience, they may be able to handle the pregnancy better. But that's not always the case. Maybe their experience in the previous pregnancy might not have been that good. So that could be counterproductive. So there is no such thing that primigravida or multis, that is second time pregnant, it's going to be better. But it's better that they are prepared. They know what they are getting into and what to expect and how to handle the situation. Rather than pregnancy, it is the aftermath. Birth of the baby and handling the baby, managing the baby is more stressful than having the pregnancy per se. Me being a mother of two, I know that I would wanted my children to go back to my tummy. the kind of naughty things that they were doing, like, okay, I can't handle you because you're out. You please go back to my tummy. You were under my control that time.
Thank you.
Those are some. I mean, there are pretty kind of pros and cons for everything, and each person has different needs and different things. So every care has to be tailored to each person.
And this is the beautiful thing, Sumar, you know?
Yeah, and Dr. Gowda, just want to ask the question. At what points along any female's journey should they come to seek your services? So is it right as you get pregnant, or is it...
as I said before you're pregnant, because I would also let you know that I am also a clinical geneticist, so I have 3 years experience in this. So what I have seen in my practice is, if they come after the pregnancy, most of the things are not recognized and it might be too late when they get pregnant. So I would suggest that you come when you are planning to get pregnant, so that 3 months ahead your preparation starts. And of course, during the pregnancy, we start early on. We have to confirm whether pregnancy is in the uterus or in the womb or outside, because that is one of the most dangerous conditions that women can encounter. Because it's something, if you are not seeing where the pregnancy is, it's quite rare for it to occur, but it's dangerous for the mother, because if there is an ectopic pregnancy that we call as, if the pregnancy is implanted in the tubes, which is the commonest site for pregnancy which is not in the uterus, the tubes are very small, narrow. So if the pregnancy keeps growing, the tubes can just burst and can lead to a lot of hemorrhage, that is bleeding, which can be really dangerous to the mother. It can lead to even death. So in such situations, you do not know where the pregnancy is. So as soon as you're pregnant, it's better you get an ultrasound done. For that, of course, a doctor is needed. That is something that we can provide. So once we are sure that the pregnancy is inside the uterus, and we do a couple of usual routine tests, next visit we usually recommend at 12 weeks of pregnancy, and this is usually that is about 3 months of pregnancy. This is where we usually can recognize many of the very major structural abnormalities that can occur in the baby, as well as we offer something called as the aneuploidy screening, where we recognize some of the chromosomal abnormalities that may happen in the baby. And following this, we usually recommend that you come at around 18 weeks, which is about 5 months of pregnancy, where we again do a detailed scan, ultrasound, to see whether the baby is doing well or not. So usually during this time, the problems that mother may have is the bleeding. So bleeding during pregnancy, which may threaten the pregnancy, like for miscarriage. Those are the symptoms that we usually ask them to watch for. And later on in the pregnancy, after 28 weeks or something, we usually offer them to do follow-up every 3 to 4 weeks, because after 28 weeks, it is more dangerous for the mother. I mean, the complications that may arise are more dangerous for the mother, and it's less of a problem for the baby as such. So, for example, mother is more at risk for developing hypertension during pregnancy, diabetes during pregnancy, and most of the complications like placenta previa that we say, that is placenta being implanted in the lower segment, which can lead to torrential bleeding as the pregnancy advances. These are the things that usually are problematic during the third trimester, that is after 28 weeks. So during that time, we would like her to come every 3 to 4 weeks. So this apart from the baby growth that we do after 28 weeks. So it's a journey, continuous journey. It's not like you come at a particular point of time. So there is importance placed is different at different phases of pregnancy, but nevertheless, all the phases are important.
Hey, Shamari, now the recognizing that the 1 o'clock hour, but if you want a few minutes after, we can, if you so choose, we can talk more on whether this service is now just at all the facilities that Health City has or just one. You want to chat a little bit more for a few minutes after the break?
Yeah, a few minutes so we can wrap it up.
Yeah, no, thank you for that, man, because our mothers, if they're safe, the babies are healthy, our communities are stronger. Thanks for giving us an education. Stay tuned, join us after the news.
From Radio Cayman's newsroom, this is Headlines. Local, regional, international news.
The Headline News is brought to you by Kirk Market and Health Services Authority.
The People's Progressive Movement, or PPM, has announced that the Honorable Dwayne John Seymour has joined the party and will contest the upcoming election under the PPM banner. Seymour, the current MP for Buddentown East, has served in multiple ministerial roles, including Minister for Health, where he played a key role in leading the Cayman Islands through the COVID-19 pandemic. He has also overseen community affairs, border control, labor, and sustainability. Good afternoon, I'm Dion Anglin with your headlines and news elsewhere. The freezing of U.S. humanitarian assistance has forced the closure of almost 80% of the emergency food kitchens set up to help people left destitute by Sudan's civil war, the BBC has learned. Aid volunteers said the impact of U.S. President Donald Trump's executive order halting contributions from the U.S. government's development organization for 90 days meant more than 1,100 communal kitchens had shut. It is estimated that nearly 2 million people struggling to survive have been affected. And the Duchess of Sussex spoke Spanish during a panel in Colombia and said she could feel the country's embrace. During a discussion with Afro-Colombian women, Meghan spoke about her role as a mother and the work of the Archwell Foundation. Prince Harry and his wife have been participating in events against discrimination and cyber harassment in Colombia. That's a wrap of your headlines. I'm Dion Anglin.
Radio Cayman. More news available at www.radiocayman.gov.ky. Check out our social media pages: Facebook, YouTube, X, formerly Twitter, Radio Cayman Headline News.
Looking for fresh, healthy food that's full of flavor? Then you've got to visit Kirk Market. Our dishes are made with fresh, high-quality ingredients. Enjoy vibrant mixed greens or satisfying pasta salads. Or try one of our delicious grill options like blackened chicken, spicy beef steak, or grilled salmon. Looking for something light and flavorful? We've got sushi rolls and poke bowls prepared daily. And don't forget to explore a hot bar or build a fresh salad at the salad bar. Stop by Kirk Market today for breakfast, lunch, or dinner and taste the difference. Eat well, live well with Kirk Market.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
Radio Cayman is pleased to feature this special Sister Islands historical vignette brought to you by the Ministry of District Administration and Lands. Explore your history, explore your land, explore your Sister Islands. Captain Keith Parker Tibbetts, MBE, JP. Following the 1932 hurricane, like most young men growing up in Cayman in that era, the call of the sea was heard more strongly than any other. Keith Tibbetts Sr. of Cayman Brac was no different. After assisting with the rebuilding of the family home, resurrecting the family car, and helping other relatives and the community rebuild, he built and sold several catboats before going to Jamaica to seek employment as a seaman, and his long distinguished career got started on September 25th, 1935, when he stepped on board the schooner Admiral Sturdy, which his father built and was later sold to the Colonel family. A year later, he joined the Canadian banana boat, Lady Somers, in Canada. During his seagoing year, he visited several ports in England and made 11 trips around the continent of Africa, including a distinguished military career. This was part 3 of a special Sister Islands vignette series dedicated to Captain Keith Parker Tibbets.
I'll be back. I've got 22 more days.
Radio Cayman is pleased to feature this special Sister Islands historical vignette brought to you by the Ministry of District Administration and Lands. Explore your history, explore your land, explore your Sister Islands.
Explore your history, explore your land, explore your Sister Islands, the ultimate staycation experience. Your culture, your freedom, the land that time forgot isn't gone. It's your Sister Islands.
Discover all that our Sister Islands have to offer.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Hey, welcome back, and thanks to Mr. Shamari Scott and Dr. Gado from Health City for taking a few extra minutes. We'll believe that the wealth and health of a nation is synonymous with, health of its people. And when our people have access to great health care, competency, sense of confidentiality, but it also brings with it, Shamari, to be a parent now, unlike when our great-grandparents were around, we may find it safer, perhaps, certainly more accessible, hopefully, but it just shows what is available. So thanks for this opportunity to learn a little bit more. All right, talk to us, because we want to know whether Health City is staying, Health City Commander Bay, Health City came back. No?
Soon come.
Right? Hey,
but just to mention that the maternity services with the NICU and everything really is at our Commander Bay location and that hospital. Now, from a pediatrics perspective, if you have urgent care needs, right, with a child, we still are able to see you at East End as well as obviously Commander Bay. But this facility was specifically built for our maternity and our NICU services. And I'll hand over to Dr. Gouda so she can tell you a little bit of all we have to offer so that persons that are thinking about taking this journey, or if you find out by accident that you're on the journey, you can also reach out to us and we'll be the hopefully the institution of choice for you moving forward.
Thank you. Dr. Gado.
Yeah, about the maternity services in Health City. So many of you would have looked at the hospital. It looks really, as few people had mentioned, it's like a 5-star hotel. The ambience is great, and facilities or the infrastructure are state of the art. So, and the equipments, most of the equipments are there that you would need for the maternity services, and medications wise and the staff wise, it's fully equipped to handle maternity and the pediatric neonatal services. So we have a state-of-the-art OPD, outpatient department, where there is a room with an attached bathroom and an ultrasound which is available if at all, if we have to do an immediate scan to see how the pregnancy is going, we can do it in the outpatient department itself without women having to wait for that to happen at a later time. And with regard to the intrapartum, that is delivery services, we have an area where there are nice beds where the women can, in their early part of labor, can be cared for. And when they go into labor, we have the delivery suites, large one actually, and where they can have birth and they can care for the baby. And there is a separate suite wherein if the baby needs special care and it has to be in the intensive care unit, mother can cohabit with the baby, and she can stay in the same room as the baby. Usually it is like baby gets separated from the mother. That wouldn't happen in our facility. And if at all, if any need be arises, we have our own emergency OT services in the same place. So operation theater, if the woman requires a cesarean section or any other emergency conditions for which we need to push her to the operative theater, it is available in the same facility. So these are the infrastructure that we have. So we don't have to go to any other place or any other place for the OT. For example, in some specialties, they shuffle between the Camana Bay and to Health City Cayman on the east end, or sometimes they may have to refer to another specialty. These may not happen for these services. So apart from the infrastructure, about the manpower, or should I say women power, we have 4 doctors, so including me, and there is Dr. Indu, who is also a very experienced obstetrician who has worked in Indian Army, remember. So she's going to be very disciplined and guideline based, whereas I'm probably going to be more creative, because being in academic and research kind of field, I'm more open to changes like that. So, and we have one registrar called as Mohini, and she's quite bubbly and available all the time. And there is one more consultant who's be joining in a couple of weeks. And we have amazing midwives. There is one from Ireland, Katie and Jessica. One is from Ireland and another one is from Canada. And both these places are very well known for obstetric services. It's like well renowned. They have a lot of guidelines, and they are kind of high volume centers which handle these maternity facilities. So they are going to be an asset to our services. We have nursing staff which are specialized in these services, and they are going to be giving a dedicated care maternity services. So apart from that, a lot of supportive staff we have. And I myself have worked in a very high volume center before coming here. I mean, believe it or not, we used to have 1,200 to 1,500 deliveries per month in our institute. So I don't think that happens per year here. So you can imagine, like, even I were to be a donkey, I have become a horse now. Practice alone. So yeah, so those are the manpower that we have. And
woman power.
Yes.
Yes.
Sorry for that, women power. Thanks for reminding me.
Hey.
And services wise, we can pretty much offer all the kind of services, like from antenatal care, education, and exercise programs we have. And we have ultrasound facilities which we do ourselves. And as I said myself, I am clinical geneticist and I'm trained in fetal medicine. So I do my own first trimester NT nuchal translucency scans, as well as the fetal structural scans.
Okay.
So I'm kind of trained in the third level 3 scans. So I'll be able to handle that. Actually, even I have experience in doing the fetal autopsies also, but I don't think there is a need for that in this island. So those kind of services also we'll be able to handle. And any miscarriage which may require care, those things also we'll be able to provide. And about the intrapartum normal vaginal deliveries, of course, we'll be doing it along with the help of the midwives, and emergency cesareans, and if any other emergency operations may be required, those facilities will also be available. And more importantly, the postnatal care. It's a complete package. So postnatal exercises, postnatal education, whether you have any doubts about breastfeeding or what exercises to do, what to eat, what to drink, how often you should come for follow-up later on, and if some problems may persist after pregnancy. So even after delivery, there is still a dangerous period. So what we call as maternal mortality period is something like 42 days after delivery. Yeah. So this is these are the days where one has to be really vigilant for any complications that may occur. So our job would not start with the delivery of the baby. It would extend to postnatal care too. And with regard to the neonatal services, we have an incredibly experienced team. We have a consultant who is done his DM in neonatology, which is kind of a super specialization degree in India, where for 3 years they train only in handling the newborn babies. So newborn babies, as you know, it's like up to 28 days after birth. So they are very specialized in that. And he has done his training in Norway also. So he is going to be leading the team. And he also has 2 other consultants who are also specialized in neonatology. One has done a fellowship. The other one has the training in neonatology. So they are going to be there. We are going to be there. Both maternal as well as neonatal services are going to be available 24/7, 365 days. If there is one more day extra, we will be there for that too in that year.
That year, huh?
Yeah. So it's a complete package.
And I really appreciate you sharing that from the preconception all the way to that period of time I was trying to ask earlier. Those 42 days, because many of us think now, there's the birth, everything's okay, the checks are done, and it's all good. But if you've gone through it, that first few months, there's not just the fear and trepidation of the parents, whether it's the first child or this is child one of, how many earlier. But there's so much that could happen in that time. Prayerfully, it'll all be great. But there are things that could occur just unexpectedly. So your preparation and your observations after birth can help to mitigate the probability of some of these, undesired outcomes.
Yes, definitely. 90% of the time, nothing happens. I mean, you drive every day to your work. 90% of the time, nothing happens. But one accident can hit you hard.
Yeah.
So that's something that we do not want to happen, and we be prepared for that.
Well, I'd invite you, whether I'm here or not, whether I'm sitting in another forum or not, but to have continued discussions, because I think we want us as a people to appreciate the importance of the health and safety of the mother prior to conception, but extending into the early years, but certainly the early months post-birth. And I'll be mindful, because I think it's something that we don't acknowledge sufficiently, what we call the baby blues, the postpartum, how that affects the mother, but maybe the child as well.
Yeah, exactly. Yeah.
So is there anything you can share with us in that, thankfully it's been a successful birth, very competent delivery, everybody's happy, and as we watch and prayerful that it's all good, are there things that we should look for that could be indicative of either postpartum or possibly the child having something? Because at 3 days old, only Shamar and SF could talk. Others had to wait for a few more months, but we were talking and sharing. I mean, and we have the video to show it. Yours is on 8 track.
I also had a full head of hair. Day 3.
2 was bubble.
Okay.
So, are there things that we should look for, either as the partner, the parent, or somebody both in the mother and in the child?
Yeah. So postnatal period, we all know that it's a stressful period, and the postnatal blues that you were talking about is pretty common in postnatal period, and this is something where women unnecessarily, I mean, you don't know the reason, but they get tearful, and it's kind of an emotion that cannot be explained. They get tearful for no reason. But then the caring for the child will not be affected by that. Usually it goes off in a week or so. So those are innocuous ones that consider to be physiological after delivery. But that said, mental health problems can be a severe one in the postnatal period. So many times what happens then, there could be something that already is there in the mother, high risk for depression or psychosis, which get precipitated in the postnatal period. So postnatal period, when there is a lot of stress, she will be sleepless, she will be not having proper food, and baby will be a lot of, it will be crying a lot and a lot of demand placed on the mother. So these kind of hidden mental problems get precipitated during postnatal period. So one has to be very vigilant for that. So depression, psychosis, these are the things that have to be picked up early on in postnatal period, and they do require immediate treatment, because this could be really lead to a lot of mental problems in the later life, and also many women are prone to suicide and attempts during this period. So this happens rarely, but nevertheless it does happen. And caring for the child also, it depends upon the mental, it's largely dependent on how the mother is feeling. If she is feeling good, relaxed, and she has a lot of support from her caretakers, she will also get good amount of sleep, she can care for herself. So she will be better prepared and has a better mental ability to take care of the child. If mother is not feeling well, definitely the care that she gives to the neonate, the baby also gets affected, which can in turn affect the baby. And lot of problems that happen in the adult life are attributed to what has happened in the fetal life or in the neonatal life. So if things are not going well when baby was in the uterus or immediately after the birth, it will have long-lasting implications for future, and which are hard to reverse. So it's better that the proper care is given during the delivery and prenatal delivery as well as the immediate postnatal period.
And as much as we're going to close on a positive, I just want to ask one more, and that is so crucial: the environment that the mother is in, and by extension, while the baby is in the womb. That environment you were sharing, as positive and nurturing and supportive as it is, the better it is for everyone. So that post-birth, there's a period of time. For some of us, we see these emotions, we're not sure, we ignoring them as caregiver, as partner, as even as mother. Does that extend for in our minds a couple of years after, or is it maybe just months? Because we may be dismissive of it, not understanding that something is not.
So usually, as I said, the postpartum blues that develop in the mother, it's not going to last forever. Usually just 1 or 2 weeks and the mother gets over it. And these kind of cases, in these kind of mother, we may not be prone to develop any mental conditions in later life. So they may be off guard. You don't have to intensely monitor them. But however, if they have displayed some symptoms of depression or psychosis like that, they have to be on lifelong follow-up. So this can keep resurfacing later on in life. So that is something that we would like them to get consultation with, counseling with, and sometimes have to be on lifelong medications too. Okay. So that is something that...
lifelong.
Yeah.
And thanks for sharing that, because in preparing for today's discussion, I had a conversation with someone, and she shared with me. She didn't realize it until many years after the birth of her last child.
Yes.
Right? And didn't know. And now that child is a young adult, only recognizing after the consultations and the therapy and friends sharing, because we don't talk amongst ourselves as parents about our experiences.
Exactly.
Right?
Yeah.
And to see the impact. So thank you. So tell my all the mothers out there, if I may borrow from you, you correct me. Don't ignore it. Don't feel maligned because of it. And even now, hey, go and speak to someone, get help.
It needs professional help.
Yeah.
You can't ignore it. We think we can get over our emotions and we can overcome that. So there is only certain amount of emotions and certain amount of mental stress that we ourselves can overcome. After that, we need help. We need help from our partners, we need help from our supporting families, and sometimes we need help from the professionals. So that is something we should not ignore. Help is available, so why not use it? Why take all the burden on ourselves?
All right.
Share it.
Well, thank you, and I'm looking forward to more information and education through you directly and your team, and to the wider community being receptive of the resources that are there, seeking that help and recognizing the importance. Shamari, thanks again for always facilitating.
Always a pleasure to be here.
Yeah.
I was just looking up there at that image of, you see, look what
I get used to it.
What filters can do. That's a very
good picture.
Very great, but that was a great picture of you right there. So
well, I can't take credit for it. It shows what a good photographer can do, and I thank her every day. I'm reminded of how important it is to have good people with skills.
Yeah.
And no filters, my friend.
Yeah. No
just
filters.
A great photographer.
Oh, okay. All right. But just to say, if you need any of our services from a maternity perspective, you can call us at 640-4040 or info@healthcity.ky, as well as our Health City Connect app. If you want to download that Connect app, then you can definitely schedule an appointment that way, or traditional. Give us a call or email us, and we'll definitely get back to you if you need any of our services, and specifically Dr. Gowda's services as well.
Thank you. We have the utmost love and respect for our mothers. We appreciate them the older we get. When we ourselves become parents, we appreciate our fathers, but we realize how much our mothers, by extension, all of the women in our lives. And Dr. Gowda, thank you. You've been a great teacher.
Thank you so much for having me.
All right. All right, we're going to pause and take a break. And as Shamari said, not a bad photo, It shows you.
We went into overtime, Dwayne. You wouldn't know anything about overtime from a sports sense, but
But you know what it is, right? Yeah. I get a job done.
Oh, you have to go overtime.
I don't have to go overtime. I take my time, but I do it right the first time.
Okay.
That's why we're going to see as we go forward.
Definitely. Make sure you take your time and comb your hair properly next time too.
Listen, the song says, I don't like coming home in a heated rush, Something slow high. Slow and steady wins the race, man. That's true. But doing it right. Now pause and take a break. You want to get it done? Well, stay tuned.
Stay cyber secure with Cayman National. Here are a few tips that will benefit you. Ensure to log out completely when you finish any online banking activities. Be aware of phishing attempts and only click links from trusted sources that are sent from your device through emails and messages. Remember, Cayman National will never ask you for your credentials. If you suspect a fraud attempt or that your account has been compromised, please immediately contact our customer support team at 949-8300.
Did you know that Doctors Hospital provides urgent care services 24 hours a day, 7 days a week? And Doctors Hospital's urgent care physicians have access to the most advanced MRI and CT imaging in the Caribbean, providing reliable diagnostics when you need it most. When you need quality urgent care for an illness or injury, Doctors Hospital is here for you 24/7. Whether it's a migraine, chest or abdominal pain, shortness of breath, broken bones, or another urgent need, Doctors Hospital at the top of Walker's Road. Urgent care right now.
Easter vacation is just around the corner, and Cayman Airways has added multiple extra flights to some of your favorite destinations, some of mine too. Look here, they got seats available now for booking on extra Easter flights between Grand Cayman and Kingston, La Ceiba, Miami, Cayman Brac, Little Cayman, and you can even catch a non-stop flight to Montego Bay for Easter. Check it out. You can visit CaymanAirways.com, contact a local travel agent, or call Cayman Airways Reservations on 949-2311. And don't wait too long though, because these extra Easter seats always sell fast. Be sure to add your Sir Turtle Rewards number to your booking so you can earn more miles for more free trips this year. But I know where I'm going. I'll see you on board a uniquely Caymanian airline for Easter.
If you or your loved one is facing cancer, only Sylvester will stand firmly by your side at every step, from diagnosis through survivorship, providing you and your family peace of mind and assisting with everything you need before, during, and after your stay with us. Sylvester Comprehensive Cancer Center is South Florida's only NCI-designated cancer center and specializes in treating the most complex cancer cases. Your first-class cancer care is just a flight away. Learn more at sylvester.org.
Attention all residents of Savannah and surrounding areas. The Lions Club of Grand Cayman PACE Committee invites you all to their prostate and colon cancer awareness meeting on Thursday, February 27th at the Savannah United Church, starting at 7 p.m. Guest speakers are Dr. David and Dr. Mubin from Grand Harbor Medical, who will be discussing colon and prostate cancer diagnosis, treatment, and prevention. Men, come out and get your PSA test done for free. Remember, early detection saves lives. Refreshments will be served.
Attention Cayman! Transform your kitchen for less with Granite Express, Cayman's big clearance sale. Until February 28th, get huge discounts on granite and quartz kitchen countertops. Plus, refresh your space with our cabinet respray services for as low as $3,950. If you only want a countertop, prices start at $2,150. Don't miss this limited time offer. Visit Granite Express Cayman today or call 922-0424 for a free estimate. That's 922-0424. Granite Express. Quality stone. Unbeatable prices.
Follow Radio
social media, X, formerly Twitter, Facebook, Instagram. Interact with our talk shows on YouTube. Download our official Radio Cayman app, or you can log on to our website, www.radiocayman.gov.ky. You can also add us to WhatsApp
on 925-3261.
All the latest information, breaking news, community events, and more. Radio Cayman. Radio Cayman's Talk Today. What is on your mind, Cayman?
Hey, welcome back, and thanks so much for joining us. I think all in Sunday Lake would appreciate the importance of having, as many would have come to appreciate, my own perception when it comes to the perspective that the true pillars in our community are none other than a strong, robust healthcare sector that is not only affordable and accessible as well, and then an equally robust education system. So chooses continued partnership with our friends over the Health Services Authority only cements the partnership that we have. And thank you for finding your way. I'm sorry the chauffeur didn't come collect you. I'm sure the valet parking wasn't available.
Yeah.
But next time.
Yeah, it was kind of lost. Google sent me on a wild goose chase.
Google, see, I tell people, don't listen to Google. Google is not right. I have a friend who tells me, she said, Google knows. No, Google doesn't know.
Doesn't know everything.
Yeah, man. I'll tell you next time, follow the clouds. You'll get there easier.
Promise.
How are you? Welcome.
Yeah, well, thank you so much for having me.
Right.
Yeah, well, again, I'll introduce myself.
Yes, please.
My name is Dr. Barry Taylor.
Yeah.
I'm one of the HSA radiologists. I work in the radiology department at HSA, so I'm responsible for doing the diagnostic reporting. I'm originally from Barbados, but I just started here in December, so fresh and green. I previously worked in Turks and Caicos as the radiologist there at InterHealth Canada Hospital. So I just migrated from there in December to join the team here at HSA.
All right. It is for me something that I always looked at, and I'm so glad that increasingly, not just through friends, but through this opportunity to sit here and facilitate, to recognize that in medicine, more than ever, it's complementary.
Yes.
Not as competitive as we may think from the television shows or the like.
Yeah.
And that is commendable.
Yeah, because our service really is to the people.
Yeah.
Is to make sure, my job is to help and, be a part of the service for the people from the radiology, especially advice and everything else.
Yeah. Now, maybe we know, but if it would be helpful, as you explained, introduce yourself, thank you for that, Dr. Taylor, but in radiology and what you do, could you expound on it just a little so we get a perspective of how that fits into our overall healthcare?
Sure. So as a radiologist, what I did med school, and then after medicine, you can do specialist training. So I specialize in what we call radiology. Really and truly, I do X-ray report. I do reporting for diagnostic imaging, including X-rays, ultrasound, CAT scan, MRI. So I am part of the team when the patient goes to see the doctor and the doctor orders an investigation. So I'm part of the team where if they order a chest X-ray or ultrasound or MRI, etc., I'll give my opinion to give the doctor information that they can use in order to treat the patient. Right. I also do some minor procedures, including like breast biopsies and stuff. So using the imaging, we can be able to target certain lesions to get a sample that the pathologist can analyze to also get part of information to help the patient. So basically, I'm part of the diagnostic team. I'm the one responsible for looking at the images and then giving an impression of what exactly is going on. Then the referring physician uses this information to kind of treat the patient based on my guidance.
Okay, guide me so that I understand. Patient comes in and the physician, she's ordered an X-ray, for instance.
Yeah.
The right shoulder, the left knee, whatever it is.
Yeah. So the patient goes from there to our department, the X-ray department, and then they're seen by a radiographer. This is the tech. So the tech now would position the patient for whatever studies. If it's an ultrasound, they would be lying down doing an ultrasound on whichever area. If it's an X-ray, they'll be exposed to X-ray to take a picture of their bony structure, and then these images are sent to an archive. Is a network that I access, and I will pull up the patient's name, see what study they had, and then I will give my interpretation, which goes back to the referring physician. So it's all part of the cycle.
And as a medical doctor, you can speak the jargon, understanding exactly what, this X-ray or this MRI or, whatever scan was requested.
Yeah, whatever is showing.
Yeah.
Based on the patient's clinical history and the reason why they're coming to the hospital, so the doctor will get the information so they can treat the patient, basically. Yeah.
And many times, I've read them for my own self or for others, and I go, okay, I thought I was reading English, right? So you speak in a language to your fellow physician to relate. Then you go back to the physician and you get this, explanation.
Yeah, how this information has given them an idea what the diagnosis is, and then the next step will be what treatment is best to help the patient.
Okay.
Yeah.
All right. Well, I'm grateful because I keep saying increasing to us as would be patients, but just as taxpayers now. Yeah. We may not want to necessarily use that word in the community anymore, but if we don't fund the services collectively, then the services can't be expanded, and if they don't become accessible, then how are we going to be improved as a nation?
True.
If that, what are you looking at it? And in particular, we're hearing increasingly about bone density and osteoporosis and what we can. And I know the facility at HSA has made increasing strides.
Yeah.
Maybe born from the metaphor of bones, but anyway.
So basically,
talk to us.
What we're talking about is something called a DEXA scan, short DEXA. Basically, is bone densitometry, dual energy X-ray absorptiometry. It's really a big mouthful, but basically is using X-ray to determine the density of the bone. And the reason for this is basic function is to diagnose osteoporosis. So it's using a very small dose of ionizing radiation to produce pictures of inside the body, usually the lumbar spine or the hip, in order to measure the amount of bone loss. The reason for this information is used to diagnose osteoporosis. And I'll tell you more in terms of why it is this is important and how it can be used for people in the community, etc. So basically, as I said, to diagnose osteoporosis, which is to evaluate an individual's risk for fractures, basically for getting fractures and stuff. It's simple, it's very quick, it's also non-invasive. And like I said, it uses low dose of radiation, which basically is 1/10 of the dose that you would get for a regular X-ray or even a full day of exposure, to the sun. So the reason why it's important for patients to understand this, that way they will get it, because anytime you hear X-ray, you hear radiation. So there's always a risk. So what the machine does is uses a very low dose of radiation in order to produce the image, and then the computer system provides an algorithm to give you an idea of what the density of the bone is. And basically, this density gives you an idea of the risk for the person to get a fracture.
Right.
Yeah.
And as I listen to you, I was thinking bones and calcium. Would any of these, particularly the bone density scan, consider calcification in the body? And if so,
yeah, well, basically the density is based on the calcium. So the bone structure is built up by the calcium. There's an outer cortical bone, which is just what you will feel on the outside, that provides kind of the outer shell, and then there's an inner network of the bone matrix that also builds up part of the overall density of the bone. But what happens is we get older, which is a part of the natural process, this inner network lattice, it decreases with age. And the reason being, this is just a natural occurrence because our hormones decrease. It's just an unfortunate, I wouldn't say side effect, but an unfortunate natural process that everybody goes through. Their hormones are not as secreted when they were younger, and what happens, it allows the bone matrix to kind of resolve slowly. So it is part of a natural process. So the reason for the test is to determine how much of this resorption has occurred. Right. But I will give you an idea in terms of the indications when we use it and stuff, so that you can kind of get a full picture as to how we can use it. So basically, according to the International Osteoporosis Foundation, osteoporosis is estimated to affect about 200 million women worldwide. Men also experience the condition. What happens is it weakens the bone and makes them subject to fracture. Though more women than men have osteoporosis, men, more likely than women, are likely to die after breaking a hip, which is interesting.
the women will tend to get the osteoporosis more, but when the men get it, if they get the fracture, they have more complications. So regular screening is used to diagnose osteoporosis and other bone problems. So what is recommended is for all females over 65 and males over 70 to get the scan. And the reason being, I'll give you an idea in terms of what the symptoms are, so that you can kind of understand. So the basic general recommendation is above 65 for all women to get the scan, and men above 70. And it shows that basically 1 in 3 women and 1 in 5 men over 50 are at risk for the decreased bone density. And I'll give you an idea based on the hormones exactly why this comes about. So bone health is important because, like I said, bone density decreases over time. And the most common fractures occur in the spine, the wrist, and the hip, because those are more the joints that we kind of tend to use more often and depend on. Women over 45, osteoporosis accounts for more daily hospitalizations than diabetes, heart attacks, and breast cancer. So basically, something that you're not aware of, you think you go to the hospital if you have problems with diabetes or even cancer, but osteoporosis accounts for a high amount of the hospitalizations. I myself am also, I wouldn't say a victim, but my grandmother had a fall and had a fracture and went into the hospital, and then basically she died from complications in the hospital. So I can tell you from a fact that I'm part of the actual, I'm also a human being as well too. So I would very strongly recommend that it is important to kind of do these tests to basically determine the risks. Then I'll give you more information, tell you how we can use this information to benefit us. So as I was saying, to the risk factors, as I was saying, so the test can assess the individual's risk for developing the fracture. The risk is affected by the age, body weight, if the patient had a previous fracture, if the patient has a family history, meaning, like for me, my grandmother having the osteoporosis, so this puts me at risk for getting osteoporosis because it does have a genetic component based on it. And then certain lifestyle issues, for example, cigarette smoking, excessive alcohol consumption. So basically, you have to take the person and their basic clinical history in one picture. So every patient will be separate. The recommendation is for a particular age, but every patient, based on their lifestyle and certain other factors, will determine whether they are more at risk or less at risk. So these factors could be considered when deciding if a patient needs therapy. So other special categories where it's recommended: postmenopausal women who are not taking estrogen replacement, elderly who are bedridden, because the whole makeup of the bone forming, the more active you are, the more the body reinforces the bone. When you're not active, the body says, okay, I don't need to support the body that much, so it shuts off the bone factory. But the more active you are, the more you do weight-bearing exercises, what the body does to protect you, it strengthens the bone. So the less activity that you do, the less the bone is actually reinforced. So that's why you would encourage people to exercise and that kind of stuff. Obviously, it's not possible for everybody else, but there are other therapies that we can do as well too. And then, like I said, postmenopausal, there are also secondary causes. For example, patients with rheumatoid arthritis, chronic kidney disease, liver disease, or patients who are on long-standing medications like steroid medications. So
or statins, maybe?
Statins, not so much.
Not so much? Okay.
Not so much. It's basically the corticosteroids like prednisone, anti-seizure medications, and thyroid hormone replacement medications. So again, is linked to this hormonal imbalance.
So the hormone replacement therapy could be also...
It could affect how the body responds and develops the bone as necessary, because everything is kind of linked to the hormones in the body.
Okay.
So like I said, secondary causes: hyperthyroidism, Paget disease, and like what I said, the sedentary lifestyle.
Yeah.
So the less active you are, the more at risk you are for having this osteoporosis. Some of the warning signs now: if you notice you've lost an inch of height over a particular time, It's interesting, you kind of say that because as you get older, you find you kind of slouch down more, which is part of how the body, the structure is not as firm as it used to be. So loss of inch of height, unexplained back pain without trauma. If you're noticing you're having this back pain that you haven't had and you didn't have any severe trauma, unfortunately, most patients can be asymptomatic. You may not even feel it.
Yeah.
Because this process is going on inside of your body, and the only time you may be aware of it is if you do have a fracture.
Yeah.
So that's the unfortunate.
So the bone is then more fragile, susceptible to
even
fractures,
minor trauma, stuff that you would normally do. We all fall, we all hit, bump into stuff or whatever, but you may only be made aware when this happens.
This thing happens. Yeah.
So that's why this information helps to kind of put your whole lifestyle modification into check. Because if you know that you're at risk, then you would do there are other therapies that I would explain how to treat it, and that kind of stuff.
Yeah. So let's take the quick break. When we come back, share more with us, because I think the more that we understand how we can make lifestyle modifications, we can improve not just the quality of our life and the enjoyment, but extend the life. Add years to life, but life to our years as well.
No problem at all.
Whatever people say, if you don't use it, you lose it. Well, this is what they mean, Stay and don't move, then
that
you become...
statement alone explains the whole process.
That's what came to mind. Yeah. All right. Well, we're looking forward for you to sharing some more with us, Doc. Thanks very much.
Thank
and to our listeners, join us right after the break.
Did you know ordering your favorite sandwich from Subway just got easier? Yeah, picture this. No more waiting in line. No more fussing with cash. Just a delicious taste of Subway at your fingertips. With our new app, ordering your go-to sub is as easy as a few taps on your phone. Plus, receive exclusive deals and earn loyalty points with every purchase made on the app. Download the new Subway app today and get ready to ditch the lines and drive straight into your flavor. Visit the App Store or Google Play Store on your mobile phone and search for Subway Cayman Islands. Subway. Eat fresh.
Accidents and illnesses can strike without warning. Ouch! When it comes to urgent care, every second counts. At Doctors Hospital, we have a dedicated team of experienced doctors and nursing staff available to you 24 hours a day, 7 days a week. Don't waste time in an overcrowded emergency room when you need urgent care. Whether it's a broken bone, a severe infection, or a sudden illness, trust in Doctors Hospital's unwavering dedication to providing the best immediate care. For complete urgent care when you need it the most, choose Doctors Hospital, located in Georgetown, 16 Middle Road.
Easter vacation is just around the corner, and Cayman Airways has added multiple extra flights to some of your favorite destinations, some of mine too. Look here, they got seats available now for booking on extra Easter flights between Grand Cayman and Kingston, La Ceiba, Miami, Cayman Brac, Little Cayman, and you can even catch a non-stop flight to Montego Bay for Easter. Check it out. You can visit CaymanAirways.com, contact a local travel agent, or call Cayman Airways Reservations on 949-2311. And don't wait too long though, because these extra Easter seats always sell fast. Be sure to add your Sir Turtle Rewards number to your booking so you can earn more miles for more free trips this year. Well, I know where I'm going. I'll see you on board our uniquely Caymanian airline for Easter.
Stay cyber secure with Cayman National. Protect your computers and mobile devices with security software to defend against cyber attacks through viruses, malware, and other online threats. Be aware of unsecure Wi-Fi connections when in public. If you need to access your online banking or sensitive information on your mobile devices, try disabling the Wi-Fi and switching to data from your mobile network. If you suspect a fraud attempt, please contact our customer support team at 949-8300.
Get your tickets now for Grand Cayman's biggest one-day family fun day, the 56th Annual Agricultural Show at the Stacey Wattler Agricultural Pavilion in Lower Valley, Ash Wednesday, March 5th. Raffle tickets are on sale now at eventpro.ky and include general admission to the show. Not one, but two $10,000 grand prizes. All the fun, all the entertainment, the food, the animals, the plants, and homemade goodies. Get your raffle tickets now at eventpro.ky. The 56th Annual Agricultural Show, Ash Wednesday, March 5th.
The Water Authority of Cayman wishes to advise its valued customers of a planned service interruption in Cayman Brac. on Thursday, the 27th of February. The interruption, which will impact the entire Cayman Brac water distribution system, both north and south coast, will take place from midnight to 4 a.m. to facilitate equipment maintenance. The Water Authority apologizes for any inconvenience this may cause and appreciates the public's understanding.
Hi, I'm Deputy Governor Franz Manderson, and I'm excited to announce the DG's 5K Challenge is just around the corner. We kick off things in Little Cayman on March 9th, followed by Cayman Brac on March 16th, and the grand finale on Grand Cayman on March 30th. This year, we're supporting the Cayman Islands Girls Brigade, the Cayman Islands Scouts Association, and the 1-to-1 Foundation, each helping to shape our next generation. Join us in making a positive impact. For registration details, find us on Facebook at DG's 5K Challenge.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Back, thanks for joining us. And from the HSA, Dr. Barry Taylor joins us. And welcome aboard. I recognize that today's discussion, seemingly from many, gives us an insight into the importance of having a very significant, accessible healthcare sector for the wider populace and by extension the region, given how travel hopefully will return once again to being a little bit more convenient. We can pray. But thank you, sir, for your time. And as a medical doctor, you share, there's the radiographer, there's the radiologist who you take us through. I'll be remiss of me to not share with the listeners that you have said at the outset. Please, to our listeners, call in, ask questions. You share in a very, very instructional way. But if they want to call, you have said, feel free. Thank you. Mm-hmm. And if they want to pay, we take it too, right? Because I don't know, I could use a new T. But the number is 949-8037, 949-6990. You can WhatsApp call as well, 925-3261. You're talking about the DEXA, the DEXA bone density scan. Yeah. And as you were sharing, for the women 65 and older, and for men 70 and older, it should start. But are there any things that may be considered that should invite us to scan earlier? You talked about genetics and the like, but other things.
Well, like I said, every patient will be dealt with separately. Mm-hmm. So based on when you go to see your primary care physician, mm-hmm. based on your lifestyle. So usually we start this conversation above 50. Mm. Above 50, if you're excessive alcohol consumption, if you have excessive smoking, or if you have any chronic medical disorders, what happens is this puts you at risk even earlier. Mm-hmm. So I would say this discussion basically starts between you and your medical practitioner above 50. Okay. When, taking your situation into consideration and your risks, and then the medical practitioner would decide if you do have a risk, whether you would benefit from having the study.
Right. And you referenced, as you go into the break, signs and symptoms, I think you were saying. Mm-hmm. Thanks for sharing, because I was thinking of that, person 50, 60, 70, 80, 90. But I got some questions for those that may still be in, preteen. But yeah. Signs and symptoms, you were sharing.
Like I said, well, the decrease in height. When somebody, but usually this happens, we associate this with older people. You know how they kind of slouch over. But if you're noticing that there has been a significant decrease in height of, we say 1 inch, and people know their body. People can know when they kind of decrease in height. Also, excessive weight loss. Weight loss itself could be a part of maybe a malignant process, but everything could be associated in terms of giving you a sign that something is not right with the body. And like I said, unexplained back pain. We all get our pains as we get older, but if you're noticing that you're having this persistent back pain, not necessarily associated with sleeping, and this is something that you're not usually accustomed to having, then I would urge you, when you tell your primary care physician, then you normally start with an x-ray. But like I said, taking your lifestyle circumstances into consideration, this would be when they will determine whether you will benefit from the study. Okay. In terms of getting the study to determine what is the cause or your bone density status, basically.
All right. Well, you were sharing, this is almost like a class lesson written for the exam.
Yeah, so now I was basically going on to talk about preparation for the exam. So we get an idea of what are the signs and when we get scheduled for the stuff. So it's to give patients an idea of how to prepare. So basically, we require very little preparation. What you tell your doctor if there's a possibility or if you're pregnant. So if you're pregnant, obviously you wouldn't want to be exposed to radiation. So this is important. So you may be having the symptoms, but you have to tell your doctor or the technician if there's a possibility, if you can be pregnant, or if you had a recent barium examination. You go for these studies to look at the bowel and stuff, because what happens, this would affect the sensitivity of the study. And when or if you had a previous CT or radioisotope scan, because the isotope in the body can also affect the readings from the study. So this is just like special circumstances. But when you are asked to do the study itself, it's advisable not to wear any jewelry, not to come with any jewelry, and to wear clothing with as little metallic buttons and stuff as possible.
To remove all piercings and everything.
All piercings, if possible. When you come, we're going to give you a gown. So you're going to be expected to change into a gown, and in terms of preparation for the actual procedure, which I will tell you about as well too.
Yes.
Another advice is to not take any calcium supplements for at least 24 hours before the exam.
Hence my question with the calcium earlier.
Yeah. So what happens? The calcium supplementation could affect the sensitivity of the study. So as a rule, you don't take it for 24 hours. That way, the machine can give an accurate idea of the actual bone density that we can use in order to give you to give feedback to the doctors. But I'll tell you a little bit more of what I actually do and what information in my report is sent back to the doctor and how they can use the information after. I'll tell you a little bit more about that. In terms of the study itself, when you're coming, it's like coming for a normal x-ray. You'll be asked to lie down on a table, and they're going to use a special x-ray tube. Like I said, is low dose radiation. And what it does, the x-ray tube has two focuses. One on the soft tissues and the next on the bone itself. So they will get a reading from the soft tissue as well as a reading from the bone. But everything has to pass through the patient. So what the computer does is subtracts the reading from the soft tissue. That way you can get a reading of the bone exactly. So it uses both. As the beam passes through, you get the information from the soft tissues and the information from the bone as a total, and then you subtract the information from the soft tissue. And this gives a relative assessment of the bone density. And like I said, we scan the lumbar spine or the hip to determine, or the wrist to determine these the density.
None of the other ball joints, shoulder and nothing, you don't scan those as well, and if not, why?
This is just part of the recommendation. I guess they did many different tests in terms of many different patients, and they found that the readings from these areas gives a better assessment of the fracture risk. So this is just based on the recommendations of the study itself.
All right. And as you were talking about scores, we can talk about it more after news. And again, the phone lines are there if those want to ask a question. Certainly, if, like me, they can listen and learn. But some tests, whether CT or an X-ray, can be done with contrast. Now, you did reference that if you had any radioisotopes or barium studies or other, to be informed, the tech.
So what will happen? You would get rescheduled. So what it would be scheduled at a later date to allow for the contrast and stuff to pass out the body naturally, because we need to get an idea of the actual natural state of the density of the bone, and not have these other things to cause any artifacts or confusion with the reading.
So with that in mind, then is it a fair assumption that there isn't a bone density scan that's done with contrast?
No, it's just X-rays.
Just X-rays.
Just X-rays.
Straight X-rays
showing you of the hip, the lumbar spine. And what it does, it creates a picture. The picture has a computer algorithm to give you a score. So I guess we can go into what it is I do in terms of the assessment. So it's something called a T-score. So the T-score is based on a standard deviation. So the reading from the density, for example, if you come for the test and I get a reading of what your density is, this density or T-score is compared to the density reading of a normal 20 to 30-year-old. And then based on the comparison, it would determine whether you're at risk. So the score is usually given in terms of a plus, minus, 1 or 2, etc. So 0 is where your density is compatible to a normal person.
Right.
And then it goes to the minus. And because take into account the natural aging process, so between 0 and minus 1 of a reading is normal, meaning your density is within the standard deviation for a normal patient. When it goes between minus 1 and minus 2.5, then is in the region of osteopenia. Now, osteopenia, it just means that it is low bone density. Osteoporosis is when it goes below minus 2.5. So based on your reading, it gives you an assessment of whether you're in the normal range, osteopenic range, or osteoporosis. And then also, we can use this after we have the reading and you get the treatment from the doctor. When you get a follow-up study, we can use it in the comparison to see if the bone density has increased or the effectiveness of the treatment. So the normal recommendation after the scan and after you see your doctor and get the basic treatment ideas that I will talk about later, the recommendation is to get a repeat scan in 2 years. And then we use this reading in comparison to the first reading to get an idea of whether or not what we're doing is helping. Because that information is also important.
So we take your scan initially against the accepted sort of population data to see where you fall relative to people in your peer group.
Yeah, to the standard.
Right.
So that's the T-score. So
Yeah.
the T-score is in comparison to a healthy 20 to 30-year-old.
Right.
There's also something called a P-score. Not to complicate.
No.
So the T-score is comparison to a normal person.
Right.
And then the P-score is into comparison to a person of your age.
Yeah.
So because as we age, there's an expected normal declining bone density. So we compare it to what we would expect for somebody of your age, 30 to 40.
Yeah. Not to even confound the discussion, but I was looking at it and preparing and going back to some of the discussions way back when relative to BMI and the like.
Yeah.
And wondering to what extent ethnicity or other people, when this whole data was being collected, this person from this region being tested against this data set, how much that data set is pulling data from people from other regions that influence it now. And maybe just me being a little bit academic, but who knows?
That's a good question. That probably need a little bit more research to determine. But I know there is a genetic component.
Yes.
Just like how I told you,
Yeah.
if you have a relative that was diagnosed with osteoporosis, by standard, you're at risk.
Yeah.
Yeah. So it is recommended that you get
All
screened.
right. So Dr. Taylor, you'll share with us when you come back a couple of things from the notes, but also from what you shared that invites me to ask questions as we extend the same invitation to our listeners to do likewise. Stay tuned for Talk Today.
From Radio Cayman's newsroom, this is Headlines.
The headline news is brought to you by Kirk Market.
The Honorable Kenneth Bryan has officially rejoined the People's Progressive Movement, or PPM, as a candidate for the upcoming general elections. After consulting with his constituents, Honorable Bryan, the Deputy Premier and Minister for Tourism and Ports and Social Development and Innovation, said he chose to align again with the PPM to advance a shared vision for economic stability, social development, and responsible governance. Good afternoon, I'm Dion Anglin with your headlines and news elsewhere. A Colombian national was caught trying to smuggle drugs hidden under a toupee while boarding a flight from Cartagena to Amsterdam on February 20th. The wig contained 19 cocaine capsules, a shipment valued at more than £8,290, authorities said. The suspect was arrested and placed at the disposal of the Attorney General's office for the crime of trafficking, manufacturing, and carrying narcotic substances. And a U.S. Secret Service agent who leapt onto John F. Kennedy's limousine as it came under fire in Dallas and was pictured in famous photos of one of the most dramatic events in U.S. history has died at the age of 93. Clint Hill later became a best-selling author, but was haunted for decades by guilt over Kennedy's assassination. Hill died at his home in California on Friday, according to a statement from his publicist. That's a wrap of your headlines. I'm Dion Anglin.
www.radiocayman.gov.ky. Check out our social media pages: Facebook, YouTube, X, formerly Twitter, Radio Cayman Headline News.
Looking for fresh, healthy food that's full of flavor? Then you've got to visit Kirk Market. Our dishes are made with fresh, high-quality ingredients. Enjoy vibrant mixed greens or satisfying pasta salads. Or try one of our delicious grill options like blackened chicken, spicy beef steak, or grilled salmon. Looking for something light and flavorful? We've got sushi rolls and poke bowls prepared daily. And don't forget to explore a hot bar or Billy Fresh salad at the salad bar. Stop by Kirk Market today for breakfast, lunch, or dinner and taste the difference. Eat well, live well with Kirk Market.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Hey, welcome back, and thanks to the HSA for allowing us again this continued partnership, and to Dr. Barrett Taylor, the radiologist over at HSA, the DEXA, 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 bone density machine.
Yes, it's basically the same dual energy X-ray absorptiometry.
I leave it to you, man.
It's even a big word for me.
That's one of the things I think in school sometimes, we probably miss those days of phonetics. I'm not sure. But it's a DEXA. And male or female, and you were saying earlier. Now, when you were talking about that 50 plus or the 65 or 70, we can see that, as you shared, there is a genetic component. So potentially, if you've had a history, maybe look at the testing earlier, and in a consultation with your primary care physician, this is just another complement to the delivery of quality health care.
Yes.
But I wonder about that young person, early teens perhaps, has had injuries as a result of sport or play, and has broken limbs. Are there particular concerns that the physician, the parent, and others, now these are, thank God, just legitimate accidents and not other things. If that child has had a broken limb or two or other times as a result of falls or play or sport, would that child be potentially best advised to look at your bone density at that very early age?
Very good question. What I am is part of the team. So basically is the referring physician, as well as me, and the other people who use this information are what we call endocrinologists.
Yeah.
So the endocrinologists, they are doctors that deal with the basic hormonal status of the patient. So to be honest, I'm not sure what the indication would be for kids.
Right.
Because I know, just like you said, if you realize that your child is falling and then with these little minor things they're getting fractures. So I'm sure that there would be a general evaluation from the pediatrician or the primary care physician as to whether or not they would. So the indication is really based on the primary care physician or the endocrinologist.
Okay.
From my perspective, I kind of more focus on what the details show. But to give you in terms of like demographic data as the indication, that's more like pediatrics.
Yes.
That's more like pediatrics to kind of decide.
Yeah. And this is where, for me, as you were talking, I'm thinking, as parents share their increasing concerns, they want to make sure the child getting enough sleep and get enough food and different things, and you watch and your child, and there's a play, there's maybe a complaint, and it's not, I think, how should I put it? It's not that parent who is going to be inclined to go to the physician for every little cut, scrape, and bruise.
Yeah.
But then there may be someone who say, "Oh, that's just a normal part of growing up."
Yeah.
Many
like
of
me,
us,
because I'm old school too. So I we know that our kids nowadays they're more focused inside on the video games.
Right.
But me, I grew up climbing trees and climbing stuff.
As all of us, right?
It's a good question.
Yeah.
But as the population and our genetic or our different generations change, that's a good question. Because like I said, sedentary lifestyle does increase the risk for the osteoporosis and stuff. So with the kids not as open inverted commas, active
yeah.
as we were before, then maybe it does open the discussion as to maybe get information from pediatricians what the relative risk is.
I mean, I guess listeners can draw the inference that as I prepared and was reading, I looked at it and I thought, we know in that older person, for whatever reason, then may not enjoy that level of mobility that they did before.
Yeah.
You shared this that when we have that hip fracture, God forbid, that creates many times a life
like a downward spiral.
Yeah.
A vicious cycle.
Yeah.
So we need you to be more active to increase the bone, but you can't be active because you have a fracture and stuff.
Right.
So like I said, the information is useful to the physiotherapist,
right,
and the other the occupational therapists. So what they know, they would be able to incorporate a rehabilitation plan. So they would take into account of the patient's activity, and there are different ways you can do exercises, even if you're not as mobile, to create a weight-bearing picture on the spine using certain bands and stuff. So you may not be able to actually do walking and stuff, but there's certain exercises that can simulate the body's feel of gravity and get you to have that bone stimulation process.
Right.
So the information is helpful to the physiotherapist as well as the primary care physician. So it's all part of the team to decide how best the patient can benefit from therapy.
Right. Dr. Taylor, through you, if you would help, as I prepared, I was thinking of a couple of things. We understand that resistance training helps. I wrote it down and I looked around, and maybe it's here and I need to put my glasses on, maybe it's on another piece of paper. But there was a statistic that I came across, and I thought it was in the 70%, where if a woman engaged in resistance training, weight training and the like, it reduced the probability of osteoporosis by this significant number. And I was like, wow, that's a huge number just by adding weight training, resistance training to her routine.
To the normal lifestyle routine.
Is that really true?
I'm not sure about the 70%, but I know definitely is above 50%.
Yeah, it's a huge number, and I go, wow.
And they can actually benefit from. So I'm hoping that this talk can give encouragement to more people to, first of all, get tested, as well as the understanding and the approach that exercise on the whole would add towards the whole. But I think it starts with the discussion with your primary care physician, your risk factors, your lifestyle, and whether or not you would benefit.
Well, thank you for confirming, because I know it was above 50%.
Above 50%.
And I read it, and then I went back and I go, the number isn't as significant as the fact that it's a significant number. Right? And with that, then I thought, well, people say you don't use it, you lose it. Whether it's your brain, your muscle, whatever. We see how sedentary lifestyle. So I came back to why I asked about our children, the lifestyles that they lead, which led me to question some of you just shared. You kept saying bone, but many of us think muscle.
Yeah,
and it's the bone, right, that we are looking at.
We were looking at the bone in terms of the support structure.
Yeah.
But the muscles and stuff, they are responsible for the actual mobility of the bone under gravity, under the influence of gravity.
Right.
So the is really ironic. Patients of a higher BMI are less at risk of osteoporosis versus when you have a lower BMI and you're slimmer with a lower muscle mass, you're more at risk. So you would think that obviously BMI does have a correlation towards health, but the weight, the actual physical weight on the body is it having to carry the weight theoretically forces the bone to become stronger. So it's like a catch-22 again. So it's kind of
well. I'm glad you said that, because I did stumble upon some of those correlations.
Yeah,
and it just led me to be why some people will now take into a practice of adding weight
to kind of but then the weight now it correlates towards heart disease and other diabetes and other complications, and so it's a vicious cycle. So the increased weight may reduce the risk for osteoporosis, but the increased weight would put you at risk for these non-communicable diseases, which would put you at risk for osteoporosis. So you can't win, right? It's like you can't win. You want to exercise to lose weight, but the weight loss may affect it, So the real thing is strength training.
Yes.
And not necessarily to focus on the weight loss, but is the strength training and mobility that the body needs in order to keep this bone density at a normal level.
So building that bone density by adding increased resistance,
strength training.
Strength training. All right.
In terms of the exercises and stuff, that's more the physiotherapist.
Yeah.
I'm just giving you a general overview because it's a team effort. So the doctor, like I said, in terms of the therapies now, so there's certain medications that that you can get that will kind of help towards increasing the bone density. But it's based on the patient's hormonal status.
Okay.
So like I said, one of the indications is females postmenopausal who are not taking hormonal replacement. So is these some of these hormonal replacement therapies that can help to reduce the risk for osteoporosis. So it's basically women, going to their family care physician, getting the discussion of the possibility or if they are at risk, and the discussion of whether they will benefit from some of these hormonal replacement therapies. There's also some pharmacological medications. Is bisphosphonates that I understand that can help to kind of increase the actual bone mass and stuff. But that's more really between the endocrinologist and the patient. My job really is to kind of give you an idea of how I make the assessment and then to know that this information can help you get these therapies from your primary care physician.
I know you share this the actual testing, but sometimes many of us, and maybe many of us in this room, don't necessarily want to be subjected to these things. We're not sure. Is it painful? How long is it going to take?
So there's actually no pain whatsoever. You don't feel anything.
Okay.
So what it does, because like I said, is a low dose radiation. So it's basically getting a very low dose X-ray where there's no risk and you're not going to feel anything whatsoever. And theoretically, there is no side effects. Okay. Like I said, I have to say, there's always a risk for exposure to radiation. So there's something called a risk-benefit ratio. So based on your lifestyle and your age, sometimes the benefits will outweigh the risk of the X-ray exposure. Right. And this is a discussion between you and a primary care physician.
We're going to final break, Dr. Taylor. When we come back, I want to ask, how long does it take? We know an MRI could be scheduled for a bit, even a CT. There may be multiple X-rays sometimes. That could take a while because you didn't pay attention to what the radiographer was telling you, so you got to take it over.
Yeah.
But with this scan, is it hours, days, minutes? I mean, why don't you tell us how long it'll last, and we'll ask a few things when we come back.
No problem at all.
All right. Stay tuned for Talk Today.
Easter vacation is just around the corner, and Cayman Airways has added multiple extra flights to some of your favorite destinations, some of mine too. Look here, they got seats available now for booking on extra Easter flights between Grand Cayman and Kingston, La Ceiba, Miami, Cayman Brac, Little Cayman, and you can even catch a non-stop flight to Montego Bay for Easter. Check it out. You can visit CaymanAirways.com, contact a local travel agent, or call Cayman Airways Reservations on 949-2311. And don't wait too long though, because these extra Easter seats always sell fast. Be sure to add your Sir Turtle Rewards number to your booking so you can earn more miles for more free trips this year. Well, I know where I'm going. I'll see you on board a uniquely Caymanian airline for Easter.
Stay cyber secure with Cayman National. Here are a few tips that will benefit you. Ensure to log out completely when you finish any online banking activities. Be aware of phishing attempts and only click links from trusted sources that are sent from your device through emails and messages. Remember, Cayman National will never ask you for your credentials. If you suspect a fraud attempt or that your account has been compromised, please immediately contact our customer support team at 949-8300.
Freedom, Cayman Brac. Freedom, Little Cayman. Soft breezes, blue waters, no traffic. Unwind and rejuvenate your mind, body, and soul. Sister Island Staycations, a taste of freedom. Discover all that our sister islands have to offer.
Now, more than ever, supporting your immune system is crucial to helping your body fight off illnesses like the common cold, the flu, and COVID-19. At Valley Med Pharmacy on Walkers Road and in Buttontown, we carry all the essential vitamins and minerals to help support your immune system and improve your overall health. Some of our top immunity support picks are vitamin C, vitamin D, zinc, elderberry, and quercetin, or the popular 7-in-1 immunity support. Our pharmacists are always on hand to help guide you and answer any questions. Visit Valley Med Pharmacy on Walkers Road or Buttontown. Live happy, live healthy with Valley Med Pharmacy.
Radio Cayman's Talk Today. What is on your mind, Cayman?
Hey, welcome back, and thanks very much to Dr. Barry Taylor, radiologist over at the Health Services Authority. And as we talk about the DEXA bone density scan, I want to know, because sometimes we're in our minds very impatient. We don't like to wait. But some scans, I think an MRI can take a while, depending on where. Even an X-ray, if, as I said, we didn't follow instructions. But for the bone density scan,
well, so for the bone density scan, what it is on an outpatient basis.
Okay.
So first of all, you're not going to be required to stay in hospital.
Okay.
It's on an outpatient basis. It's painless. Like I said before, you're not going to feel any pain. And the scans usually take between 10 to 20 minutes.
Okay.
The thing about what you were describing in terms of getting whether or not we have to come back. So during the scan, it's important that you follow the instruction of the radiographer, where they're going to tell you to take a deep breath. Because what this does, it reduces the motion artifact.
Okay.
But the good thing about it is that you can get a kind of instant feedback on the quality of the study, so that the radiographer can determine then whether or not it's necessary to repeat the study. So the only way you will have to repeat the study is if it's part of the follow-up process, like the 2-year follow-up that we mentioned, where doing a follow-up scan in 2 years can give the healthcare practitioner information of whether therapy, or be occupational therapy or the physiotherapy, is helping or is improving the bone density.
Okay.
As well as is also non-invasive, and you don't need any anesthesia. So we're not going to give any anesthesia or anything. And what I wanted to say, as I was pointing out from earlier, that the test cannot predict who will get a fracture. Because I know that I said that the test is used for the diagnosis of osteoporosis, which can give an idea of the risk, but we can never predict who will experience the fracture. But the test can provide a relative risk for fracture, where if you implement treatment in the early, this can reduce your risk. So the important thing is to get the information so that you'll get treatment early to help to reduce your risk. But the test, unfortunately, we cannot predict who will get fractures or not. But information is used so that the primary care physician, as well as the patient, and with their lifestyle modifications, stopping the smoking, reducing the alcohol consumption, the weight strengthening, not necessarily weight gaining, like we talked about before, can all these factors can reduce their relative risk.
Right. And this is something that you shared that perhaps some of us recognize, that even though that added weight to our bodies may strengthen our bones, as you reference, it lead potential to other health
non-communicable diseases,
right.
Heart disease, as well as hypertension and diabetes, which as a catch-22 puts you at more risk for the osteoporosis. Yeah.
So if we understand through this bone density scan where our bones are, the potential, onset of osteoporosis, we could make lifestyle modifications.
It's all part of the lifestyle modification. Then you know your relative risk, and then you can get either medication or maybe even physiotherapy and strengthening exercises to help to reduce your relative risk.
Okay.
Yeah.
What more, as we close out our discussion today, Dr. Taylor, that you want, not just, specifically, patients who are listening as they go to their next, checkup, they go and make an appointment with their primary care physician to maybe ask about this as part of their ongoing maintenance and health check, as it were.
Yeah.
What things would you want us to know?
So I would say anyone, even though the recommendation does say 65 or 70, anyone above 50, with their annual checkup that we recommend for everybody, I think anyone, male or female, above 50 should open the discussion with their primary care physician,
Mm-hmm.
who would have information on their overall general risk, and then together they can decide whether or not this test will be helpful in terms of their relative risk based on their lifestyle.
Mm.
So I would encourage, even though you say, okay, well, I'm not 65, I don't need to do anything, anyone above 50 should open the discussion. And then if there is an indication, then it would be for the primary care physician to order the study from HSA. We'll be able to do the test.
I guess in that notion of, the Lions Club Tropical Gardens with their breast cancer campaign, early detection.
Yes.
Or parents and their parents and their parents told them, ounce of prevention better than pound of cure. So that early intervention, that early discussion, that early, your medical colleague earlier, talking with preconception, you prepare it. So doing these things earlier, those lifestyle choices in your 30s, may find that when you're in your 60s, hey, you're healthier, fitter, stronger, probably even better looking than you were, all because of those lifestyle choices.
Yeah. And the overall thing is to reduce the risk.
Yeah.
Like I said, we can't predict what's going to happen,
right?
But if we reduce the risk, then we can be ensured that we can have a possibility of our fracture-free.
One of the things that come in the HSA and the medical community in general, but ever increasing access to more and more diagnostic equipment and more employment of resources through the personnel like yourselves.
Mm-hmm.
For our community, a machine like this, I can see benefits, but maybe you can share more for us so we understand it much better.
Well, I think for sure there should be information on our website.
Mm-hmm.
So the website can give you an idea in terms of our machine. But what we do is is an easy scheduling process, and it's something, like I said, is on an outpatient basis. So it's not something that you're going to have to require to spend the whole day. Each procedure usually takes about 10 to 20 minutes, so it's very quick, very painless. So I think once we open the discussion with the primary care physician, then patients can have in their mind whether or not they can benefit from this, and know that it's something that can be easily scheduled at our hospital, easily facilitated, and the results is going to help them understand how they can change their lifestyle to kind of benefit them. At some point, we do have to take responsibility, and this information can maybe encourage people to change their lifestyle or to do these stuff that are less at risk. So it's more of an educational thing for every person. With the information, they will encourage them to kind of change their lifestyle to benefit them.
I recognize, in decades to come, that step now will, be greatly appreciated then. But if we don't, the last time the planet tree was, 10 years ago.
Yeah, exactly.
But today is not too late.
Yep.
Dr. Taylor, thank you very much, sir.
No problem. Thank you so much for having me. I really appreciate it. I think it's very good that we can be here as a representative for HSA to give information to the community and know that we are all part of the diagnostic process. So thank you for having me.
You're most welcome. And to parents and their and the teachers and the wider community who encourage your students to consider careers in the medical field, for you and other students who had the tenacity, had that resolve to persist, we're the beneficiaries of your studious approach. So thank you.
I really appreciate it. Thank you for having me.
All right. And to Miss Susan, look at that. Almost on time. I try, sir.
Yeah.
Well, tomorrow's Wednesday. Wednesdays, like Mondays and Fridays, whenever it's not a public holiday, you get the opportunity to join Mr. Art for the record. It brings you not just informative and lively and timely and accurate and engaging discussion relative to the political cycle, but at a time such as this, I'm excited to hear what he has to say each day.
Yes.
Man. And to our voters, get prepared, get informed, get engaged and involved, because the community, through its democracy, is only healthy when we have the participation of all of our electors.
Yes, please.
An exciting time is this. Well, God's willing, join us tomorrow after the midday news, but start the day out with Mr. Art for the record. Until then, be blessed.
Talk Today is brought to you by Subway, open 24 hours in Countryside, Anderson Square in Georgetown, and Centennial Towers in West Bay. And by the Ministry of District Administration, explore your history, explore your land, explore your sister islands. And Cayman Airways, call them on 949-2311 to book your nonstop flights to Los Angeles and Panama. And Doctors Hospital, peace of mind is important when life happens. Doctors Hospital, always there for you. Call 949-6066.